Hi everybody, I'm Butch Stearns, once again here from HealthIT 2012 with Amnon Gavish from Vidyo. Amnon, how are you, my friend?
I'm good, how are you?
Very interesting presentation.
Thank you.
We, of course, at the Pulse Network are sort of in the same line of business as you are, using video and digital content to provide solutions for people. And there are so many interesting things I'd like to ask you, but from the healthcare field, from the medical field, it's pretty exciting what you're doing and what Vidyo's doing because it's groundbreaking, isn't it?
It's definitely groundbreaking. It's a disruptive technology that opened the door to so many new modalities within healthcare that people were unable to do so. And that's why we also attract a lot of innovators, physicians that had dreams or they had ideas of what they can be doing with video conferencing but were unable to do until recently.
Talk about your word, disruptive. Explain a little bit more what you mean by that, why it's a disruptive technology.
Well, traditional video conferencing was there for probably 40 years now,
right.
But it was always heavy, costly, and confined to specific rooms
right.
and networks. What we have done is we have basically did a democratization of video conferencing.
Yeah.
We enabled the same quality that was preserved only for these rooms
right.
on every network and every device. And that basically opens the ability to provide meaningful healthcare outside of the hospital to rural areas, to patients' homes, to remote hospitals, and bringing the specialty outside of the
right.
big hospital into other areas.
Right, and then when you add in just the nature of the video component, as we all know, as I mentioned when I introduced you, that we're in the middle of a content revolution. I mean, we're growing up, my kids are growing up in an age, our kids, where they demand things now, they demand it where they want, when they want it on demand or they want it live. So when you think of video, and you think of the engagement that can create, when you think of the live possibilities, and also the on-demand part of capturing it and passing it on, and then you think about healthcare and all the benefits you can create with that, it's pretty amazing all the things you could do.
Correct, and your ability to actually access this kind of services everywhere, whenever you need it, with very, very low cost of point of care, is really the disruptive point, because that means everyone on the patient side, on the physician side, is available and have access to the service wherever they are. And you don't have to actually think about getting to use this kind of service. It's naturally integrated into the workflow, and that is the key here. And that is where you can see the disruption coming in, because it's making it as simple as sitting in front of a person and talking.
Now, you're a technology guy by nature, correct?
Correct, yes.
Okay, so being in technology, again, in this day and age, in this revolution of the great content shift and all of that, it's got to be exciting for you because, again, by nature, you've been one of those gadget guys who've always thought about how to use it for business, haven't you?
Yes, for me, this is an amazing trip going into this healthcare market and understanding what we are enabling in this market. I go and I talk to physicians and I see they're lighting up. I said, oh, if I can do that,
right.
then I can do A, B, and C that I was thinking 15 years ago how I would like to do it.
Right.
So we are not creating the use cases. We are just enabling them and bringing in the possibilities,
right.
and then it's an amazing journey for us to see what people are doing with it.
Right.
And all the creativity is coming from the healthcare providers, from the physicians, from the healthcare systems that are beginning to see what is the potential in this kind of visual communication when it's actually available wherever
right.
you need it.
So talk a little bit more about that. Let's finish up with this. It's obvious from a user, from a patient standpoint, the benefits that can come from this. But when you're talking with your clients or potential clients, and you're talking to physicians or providers, what are some of the things, you just talked about a wow factor, where they say, wow, I can do this. Give us some examples of what have opened their eyes with some of your clients.
Okay, here is an example from Europe where in Switzerland and Germany they established a professional social network that allows physicians to befriend other physicians and just consult with them whenever they need. And that network today covers 3,000 doctors and 90 hospitals. And all they have to do is go to their office, go to their computer, the same way that they go to the Facebook.
Right.
They go to this cyber medical network, and they get the other physician online, and they can have a second opinion. They can consult with the specialist, and it's making it so accessible that the use is ramping up almost in a viral nature.
Yeah, and that's a great example. And what's the name of that?
It's called cyber medical.
Okay, that's a great example, because when just think of any industry and how that's applicable to any industry. And now you think of the nature of physicians and how they're always on call. Their schedules are so busy, so they can reach out to their colleagues at different times. Never mind the level of, you might be working for one provider or another, or in a country there's different language barriers or all kinds of different things. I mean, that's a true community of experts, thought leaders that have access to each other. It's a great example of how it can be done.
Correct. And another example is if you look at the ability to maintain contact with patient at home after it's been released. It's very cumbersome if you have to get the patient every week or other week to do follow-ups. It's very it's inconvenient for the patient who may be living far away. It's inconvenient for the healthcare organization. If you can reduce the cost of these follow-ups by just having most of these follow-ups done over video, you may do many more of these, and then have the ability to have early diagnosis of any problem that may arise, and then you reduce the readmission rates because you identify a problem early enough to deal with it before patient gets back into
just
the
think
emergency
of just think of the real-time advantages you're talking about. From a patient side, you're able to, if you're having a symptom at that time, ideally connect with the doctor right then or shortly after that and let them know when it's going on. How many times has a patient gone into a doctor's office and they can't really remember because it was a week ago when they last had the symptom? From the doctor's side, as you said, there's an efficiency, there's a cost factor involved here because you're streamlining the process.
Correct, exactly. Yeah. And it's very intuitive, both sides. It's intuitive for the patient. It's like I'm calling my physician, but I'm calling the physician and get immediately into an appointment. And it's very intuitive from the physician side because they can control it. They can have a very good visual of the patient. They can identify things that they would identify in an office visit in 5 minutes. Right. And no one has to travel, and it's available all the time. So that by itself is a key advantage on both sides for the quality of health for this population, as well as for the reduction in cost on the healthcare provider side.
So let me ask you one final question. You're on the cutting edge with a company like Vidyo. You're providing solutions in the healthcare IT industry and healthcare in general. What's next? What are you working on next? What are we going to see that's next?
Well, I think mobility is huge. And what we've seen is that the tablet form factor is a winning form factor for the in the healthcare environment. Mm-hmm. And the keynote speaker at the American Telemedicine Association meeting next month is the co-founder of Apple because of that. Because they figure out that the iPad and the Android alike are the key form factors. If you can provide all this control, all this quality at the palm of the physician, that they can actually walk with this device wherever they are on the network in the hospital, at home, or even in their car, like the doctor that I showed in my presentation, then you are giving it the ultimate example of mobility, of accessibility over video. So that we put a big emphasis on mobility, and also on providing this service in a cloud-based environment, because once you start to see the expansion, you are going to need to deal with hundreds of thousands to millions of concurrent users. That kind of service has to be virtualized and work in a cloud-based environment.
Right, and what's kind of cool is that it's being driven from the consumer end, because as patients, we demand it. I mean, we're in that age where we want it mobile, we want it where we want it, wherever we are, And I know IBM preaches that care is where the patient is. And when you think about it, if you're traveling and you're a patient, there's the need for the doctors and providers to keep up with that demand, isn't there?
Correct. And we want it visual.
Right, exactly.
You know, YouTube, Skype, everything. We want to see everything.
Yeah.
You know, after using video communication, you feel that when you are just on an audio call, some aspect is missing.
Right.
We are very social animals. We need to see the white in the eyes of the people that we talk with.
Right.
And that aspect is key. The generation that is going now into being physicians is used to YouTube, to Skype. So there is a consumerization of the professional environment, and there is an expectation to enable this kind of visual communication.
And if you believe my stat, about 70% of what people see, hear, and read, then that reinforces that, if you believe that stat.
Okay.
I'll let that hang out there, whether it's a true stat or not. Amnon Gavish, thank you very much for your time.
Thank you very much.
All
Thank
right,
you.
this is part of our continuing coverage of HealthIT 2012.